we don't have what's called a standards lab or a reference lab. Massachusetts is referred to as a standards lab, and across the country, people call it a reference lab. And that would be a state-run laboratory that could do independent, separate and aside from our ITLs, can do independent verification and confirmatory testing to make sure that there's accuracy in testing and labeling so that the potency, what it says on the certificate of analysis, is accurate, that the total yeast and mold counts are accurate.
So
pesticides that make sure there's no pesticides and no other contaminants.
So if the state was to put together a standards lab, that means that it was almost like a mystery shopper where you can like now, I know that's a different topic necessarily, but like are license holders potentially going to be required to send it to both the standards lab and to it? Or is it really just like you're picking randomly out of samples?
I don't know ultimately what that would look like. Maybe it could be a combination of both. So secret or surprise shopper, or you know, it's a requirement to submit it to the state-run lab. We don't have it, so we don't have any of the details, but we need it, and we need that. I think we critically need it for public health, quite honestly. And we've had reports of data manipulation and lab shopping. Now, if a lab is knowingly and wantonly manipulating data, I think lab shopping is too nice a word. That's lab fraud.
That's fraud.
That's fraud at that point.
Yeah, because you're going from like maybe a test result that says 25%, and you're like, actually, take me through that. Like,
so
is it going to like 40% or something like that? Yeah.
Right. And is it,
so how do they do it?
You talk about the TAC count. You talk about THC.
TAC, for instance.
Yes. Yeah. And if it's 40%, like how can we really don't have the infrastructure in place. We don't have our own state-run lab where we can confirm, is this truly at 40% TAC count? Right.
And you have to trust the scientists that are running these labs too, because these are highly trained scientists. So you're like leveraging them to be like, well, and then you've got to maybe bring in an independent person to be like, well, how do you know it's lab fraud in this particular case, right? So it's a lot of self-reporting.
And if I may, right. And right now, the system is inherently conflicted as it stands, because for us to do any confirmatory testing, and we have, like, remember EVALI, the vape crisis, right? But we have to use the independent testing labs.
Right.
So
you have to rely on them still.
So they're not truly an independent third party.
Right.
They're not.
Right.
So that system is inherently conflicted, and we need, and I've been advocating, we need to have the resources to be able to do independent, separate and aside from the ITLs, confirmatory testing. And it's not like we can send it to Rhode Island or a neighboring state, because you really can't ship it across state lines.
Right.
So it's not like we can do that either. So we're putting our collective heads together at the commission to figure out how we can advance this. We really need we do need the support of the legislature to be able to do that, because we would need the resources to be able to, stand up a lab.
Yeah, it sounds
the
as budget
instrumentation
and
that you would need, and it's not an inexpensive endeavor.
No.